Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF. R. 616-9534. Unit 4, Develop and maintain individual and organizational competence in health and safety matters. Enhanced Limited Copyright 2019. Analyzing the organization. The functions, jobs, tasks and roles of an organization should be analyzed when wanting to maintain a positive health and safety culture within a workplace. You can analyze production processes, materials, machinery, equipment, substances, groups, individuals, plant. Health and safety needs of an organization/individual. These can involve specialist skills, personal protection equipment, PPE, training/retraining when required, qualifications, awareness of health and safety procedures and concerns. Assessing health and safety in an organization. Analyzing data and records of accidents, near misses and radar, reporting of injuries, diseases and dangerous occurrences regulations. Referencing the health and safety of the current and upcoming legislation. Analyzing policies and procedures. Analyzing risk assessments to see if they need to be improved or updated. Observing activities that take place within the workplace. Having regular consultations regarding health and safety. Health and safety in an organization. This can be established in terms of skills, knowledge and understanding. Evidence should be collected which can show that the organization has a positive health and safety culture in place. This can be done by having a collection of data, reference to records, appraisals, interviews and consultations. Training courses can have long or short-term goals, may be distributed in-house or by health and safety representatives, could be straightforward or complex. Different training methods include lectures, assessment, examination, demonstration, use of varying media. The effectiveness of training. To assess how effective the training was, the employer could try multiple methods, for example feedback, consulting with employees, annual comparisons of accidents, incidents, absences. Individual and organizational competence. The ability of individuals and organizations could involve training, supervision, requirements due to working conditions, responsibilities of employers and employees, safe systems of work, their health and safety culture/reviews. Structure of the organization. The structure of an organization can show responsibility and accountability if anything happened regarding health and safety. It also can show job roles, job descriptions, involvement in health and safety and trade union involvement. Key principles of competence. Should be related to responsibilities, activities and tasks mentioned in risk assessments. Aim to establish and maintain skills for those involved in safety work. The information gathered from training should be strengthened by practice. Key principles of competence. Should take account for future work and operating conditions. Training and assessment methods must be suitable to the hazard profile of the task being undertaken. On the job should be linked to risk assessments and control measures. Training should be validated, evaluated and recorded. Key principles of competence. There should be refresher training. Vocational qualifications should link to the participant's organization. Aim to create a balance between competence and supervision. Consideration should be given to the aftermath of outsourcing safety work. Principles of activity analysis. Analyze the activity as it is normally carried out. When completing the activity analysis rating form, rate the activity by comparing it to all other activities. Analyze the activity without regard for any disability group. Analyze the activity with concern to the lowest level of ability required for basic successful involvement. Principles of task analysis. Take part in performing the task. Write down the steps chronologically. Observe others participate in the task. Update the list of steps with any new information. Allow steps to be learned and taught. Principles of job safety analysis. Identify hazards at each step of the analysis. Develop safe procedures for each step of the task. Competencies, skills and qualifications. A competency uses employees' skills to incorporate them into occupational behaviors. In terms of qualifications, they are the literal item that you receive after training. However, if you don't have confidence to use this qualification, then you don't have competence. An example of this might be getting a driver's license but not having the confidence to use it. Training course principles. Be aware of different styles of learning. Vary use of facilities and equipment. Consider group activates to make the course more engaging. Use different media, for example images, color, body language and tone of voice. Give tasks to participants, peer-to-peer teaching. Advantages and disadvantages of presentation methods. Example 1 method, PowerPoint. Advantages. Can maintain eye contact with audience, can add interesting graphics to make it more appealing to the audience, can be projected onto a large screen for use in a large hall. Disadvantages. Could rely on them too much, simply reading what's in front of you, audience could become bored and not pay attention. Example 2. Method. Making notes on a board whilst delivering your advantage. Keeps audience engaged with the material for a longer period of time. Audience are able to make notes easier as the information is written in note form already. Disadvantage. Time consuming to write out information that could have been prepared earlier. Audience may not be able to follow at the speed of the speaker. Principles of course evaluation and validation. Analyze the standard of training. Follow the set standard evaluation protocols. Check to see if the trainees can demonstrate certain skills/knowledge rather than just providing a written grade. Principles of preparing, delivering and marking test and assignments. Different learning styles. Ability of students and workforce. Level of test. Maintaining consistency throughout marking. Treat everyone fairly. Individual circumstances, for example, English being the second language, impairments to hearing or sight. Principles of effective communication. Identify your audience, purpose and topic. Anticipate opposition. Try not to be subjective. Deliver communication through several methods. Establish a practical way to receive feedback. Try not to communicate a large amount of information at one time. External factors. External factors can include a change of nationwide EU legislation, expectations of others, including professional bodies and customers, setting, access to emergency services, materials used. Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF.